As we age through our 40s, 50s, 60s and beyond, most of us find ourselves struggling more with our mobility. So follow me with a 10-minute daily routine that can improve the function of your hips. Hi everyone, and welcome to Exercise for Health. And this is the last of 3 videos in a mini-series that address that stiffness feeling due to a lack of joint mobility. This one will target your hips to help you with activities such as squatting down to pick something up from the floor or putting your socks on. Although these exercises will improve your mobility, they will also ensure that we add surrounding muscle strength for the increased range of movement to reduce the risk of instability in the joint. You can do this routine every day and at any time, but if you experience any cramping or get muscle soreness the day after, wait until that has subsided before trying this routine again. This will get easier though after a few times. You won't need any special equipment, but we will be doing these exercises on the floor. And although gentle by their nature, these exercises won't be suitable for everyone, particularly if you have a hip condition or replacement. However, if you experience any pain while following them, then stop the exercise straight away. Okay, let's get started. Right then, we're going to do 3 exercises to mobilize the hips. The first one we're going to do is a shin box lift. So initially we're going to set up, so I've dropped both knees over to one side of the body while I'm sat on the floor, with this knee almost touching the heel of that foot. And the idea is I'm going to use my hand for support because I don't have the strength to physically do it without it, but over time hopefully you'll be able to build up so you can. You're going to use the hand for a little bit of support to push the hips up off the floor to get them to come forward, so we're effectively resting on this knee. Lower back down slowly, and then I'm going to switch to the opposite side and then do the lift on this side, bringing the hips forwards, hold momentarily, slowly back down, and then switch. So we're getting this rotation of the hips in between. We're going to do it 5 times each way. So set yourself up ready. And then from there, lift the hips up and forwards, slowly lower back down. Again, use your hand for support if you need it, like I need it. Switch over and then lift up on that side. So I'm finding that side much easier to control and to lift compared to this side, where I need a little bit more support. Good, we're going to do this 5 times each side. So that's 2. So we're going to hold that momentarily at the top as you get that extension of the hip here. Hold that momentarily, and then as you lower down, just do that slowly so you can really work into that active strength on the muscles around the hip. That's 3. 2 more each side. So rotate and then lift. Slowly down. Rotate across and lift. That's 4. Let's just do 1 more each side. So we're getting a lot of rotation as we switch from one side to the other side. Internal rotation on one, external rotation on the other. Good, and then come back to the middle. Right then, so that was rotating the hip. What we're going to do now is we're going to work on flexion and extension of the hip. So for this one, I want you to get into a long lunge position so that the back knee's on the floor. If you need a cushion to support the back knee, then that's fine, put a cushion underneath. But essentially what we're going to do is we're going to, one's flexed, one's extended, but we're going to work on tilting the pelvis while we're in this long lunge position. So the way we're going to do that is we're going to push the hips forwards, allow the hands to drop to the inside of this front foot, and then from there I'm going to think about pushing my belly button down to the floor, trying to get the tailbone of my spine to point up in the air. Hold that momentarily. Then we're going to come back upright and I'm going to tilt the pelvis backwards. This is where I'm going to try and tuck the tailbone underneath me. So now I can engage the extension of this hip. And we're going to switch between the 2. We're going to do it 5 times each way, and then we'll swap over and do the same on the other side. So get yourself in your long lunge position. So push the hips forwards, hands drop to the floor, push the tailbone of the spine up in the air behind you, hold that momentarily, come back upright. Now tuck the tailbone underneath you. So that's 1. Switch back to the first one. Push the hips forwards, push the tailbone of the spine up in the air. It will feel quite restrictive. Come back up. Think about tucking the tailbone underneath you. It's 2. So flex, push that tailbone to the spine up in the air. That should feel that on that front hip. And then when we come upright and we tilt the pelvis backwards, you'll feel it on this back hip. 2 more. Back it upright. Again, the tilting bit probably won't find there's much movement at all, depending on your mobility. But as long as you can actively try and do it, you'll be working into strength as well as mobility around the hip. Right, that's 5. Let's switch legs so we can do the same on the opposite side. So set yourself up. So starting going forwards, hands drop to the floor. Think about pushing the tailbone of the spine up in the air behind you. And then come back upright. Now think about tilting the pelvis backwards, so you're trying to tuck the tailbone underneath you. And that's where you feel it on this back hip. Go back to the first one. Push the hip forwards, push the tailbone of the spine up. Come back upright, tuck the tailbone underneath you. So that's 2. 3. So just hold in that end range momentarily before we come back out and switch the opposite way. 4. 1, tuck it underneath. That's 5. Okay, good. Right then, the last one we're going to do is active circumduction. And this is where you're going to lie on one side. So with circumduction, we're basically taking the hip through its full range of movement. So what I'm going to do from there, just make sure you're supported when you're on the floor. I'm using this top leg first. I'm going to start off by flexing the hip as much as possible. So I'm trying to bring this knee up as close as I can to my chest. Then we're going to take it from there, round behind you, but we're going to do it in a circular fashion. So effectively going to go up. So it's right up towards the ceiling, rotate, take it back behind you as far as you can, behind, and then we'll then reverse it and bring it back round to the front. But we'll do it quite slowly. So we'll end up doing it 2 times each way on one leg, then we'll switch over and do 2 times each way on the other leg. So get yourself comfortable on the floor. Use a pillow to support your head if you need to. And then top leg, bring the knee up. So actively use these muscles. Don't use your hand to help. Actively use the muscles, try and lift that knee up. Now we're going to begin to rotate. So we're always trying to lift the knee. Keep the knee as close to your head as possible as you take it round to the side. Now you're going to have to begin to rotate the joint a little bit. Keep the knee up as high as you can. Now to start to take it back behind you, but you're trying to force it back. Be careful you don't arch your back too much with this one. And then we'll reverse it to come back round. Work these muscles, lift the knee up as high as you can. Keep it as close as you can to your head. Begin to externally rotate. Keep it up, keep it up, keep it up. All the way around, back to the front. Let's do that one more time before we swap sides. So lift, keep it up as close as you can to your head. Really work into these hip muscles as you rotate. Keep taking it then back behind you. Work those glutes to open up the front of the hip. Good, and then reverse it back the other way. So again, trying to lift the knee up, keep it as close to your head as possible. As you begin to rotate, keep it up this way. Really feel these muscles working in the hip until you're back to the front and relax. Right, let's switch over and do the same on the opposite leg. So get yourself comfortable. So top leg, actively try and draw that knee up as close as you can to your chest. And then from there, taking it up. Remember, we're trying to keep the knee up as high as possible, as close to your head. As you take it round behind you, rotate. Take it back as far as you can as the knee drops down a little bit. So you can feel these muscles work around the glutes. Now reverse it. Slowly lifting it up to the side. Again, keep it as close as you can to your head. So you can really work into these muscles around the hip. All the way back round till it's back in front of you. So lifting it up as high as you can. One more time through. Take it up to the side. Keep trying to lift it up close to your head. Rotate. You should feel that around the hip, take it back behind you. So still trying to take the knee back as far as possible, and then reverse it to come back round to the front. Slowly, 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 really work into those muscles. Feel those muscles working around the hip to engage that movement. So working strength into that mobility, all the way back round until we're back to the front. And then relax. And that's your hip mobility workout done. I hope this short routine improves your hip mobility. If so, please give it a like by clicking the thumbs up button below, and consider subscribing if you haven't already. You can check out the description below for further information, including a link to a playlist of other videos that can help your joint mobility. But thank you so much for watching, and until next time, stay active and keep moving to feel better.